about ECT. It's gotten a very bad rap, and in the past, bilateral ECT, which means you zap both sides of the brain with this current, could cause memory problems more often than we'd like. Today, modern ECT only does one side of the brain. It's much less likely to cause severe memory impairment, although it can rarely. And it is quite effective and in fact can be life-saving. I've seen people who've tried every med, every psychotherapy, doesn't work, but ECT does in those cases. You don't use it first. But if the alternative is a miserable life or death by suicide, I say do the ECT because it can be very effective without doing you much damage these days. So people don't like the idea of it, and there's new things coming out like transcranial magnetic stimulation, which is a brand new thing just approved by the FDA, which instead of ECT uses a strong magnet to induce certain changes in the brain. From the research I've read, it's not as effective as ECT, but less likely to cause memory impairments. But if you have a really nasty mood disorder that is not responding to medications or psychotherapy or both, ECT can save your life. Now, I trained in San Francisco where it was politically incorrect to do ECT. We tried to do ECT, we'd have pickets outside our hospital. So we had to go to Daly City to learn it. Which we did do. And I don't think there's anybody who does ECT in this county. You probably had to go out of county to get it, am I right? Or did you get it here in Nevada County?
They just referred me right to Sacramento.
Right. So, anyway, it can be life-saving, and it can be effective where all other modalities have failed. So, although it sounds kind of creepy, it can save your life without any long-term severe side effects these days. All right, we're ready for a basket? Oh, not quite.
I have one question. Could you maybe mention the percent of major depression that's misdiagnosed, bipolar 2 that's misdiagnosed as major depression? You mentioned,
I don't know the answer. Sorry.
So there's no...
You got the answer that the best doctors give. I don't know. Only the best doctors will say that. Any other questions?
Go on.
All right, let's take a look at this basket. Which currently is better resource for professionals, DSM-3R or DSM-4? The best current resource is the DSM-4-TR, which is the slightly updated version of the DSM-4. They didn't change any of the diagnostic criteria, just the descriptions about it and certain of the facts about differential diagnosis, prevalence, and so on. And I think it's best to use the most modern one. Okay. Does bipolar disorder usually begin as only depression and progress into bipolar, or does it start as bipolar disorder? It usually starts with a depression, unfortunately, although sometimes you see a manic episode first. Sometimes it'll present as manic. And I have a couple of kids, a couple of patients in their 20s who've just had manic episodes so far, never had a depressed episode. That's not typical. Okay, next, how long do most people's down cycles last? And do up cycles last equally as long? Good question. I assume this means for bipolar type 1 or 2. Depends on several factors. Depends on if it's treated or not. As I said, the down cycle has to last at least 2 weeks for a major depressive episode, and it can go on for months or sometimes years. Unipolar depression will almost always clear eventually. So the person will go from if there's no suicide, without treatment, the person will go from very depressed to okay. But the chances of it happening again are rather high, at least 40%. And upcycles last equally as long. It varies. I've seen upcycles last months. Usually these days, the people I see get treated, so the upcycles don't last as long. Vote no on Proposition 8. There's a blank. So here's one. Do you do any private practice in Nevada City? The answer is no, no private practice. Would you please talk about bipolar mixed states? Is this a typical progression? Started with a 5-month depression and 3-month highs every year. Is it more severe form? Does it cause brain damage? Well, I already talked about mixed states. To meet DSM-4 criteria for mixed state, and I believe this will be different in DSM-5, you have to meet all criteria for a manic episode, and you have to meet all criteria for a major depressive episode at the same time. And it really is the most severe type of mood shift in bipolar disorder. It's often more difficult to treat and often causes a lot of distress, certainly more distress than a manic episode alone. It typically does not happen first. Typically people will have several manic episodes and several depressed episodes before they get both at the same time. Does it cause brain damage in its severest form? That's not been settled yet, but my hunch is that it can, especially if it's left untreated. There's arguments about that. See, with these disorders, it's different from physical disorders. If you have a heart attack or coronary artery disease, you can see your heart on an echocardiogram. You can see what your heart's doing with a CAT scan that looks at your heart or an EKG. But for these disorders, they're going on inside your skull, and if you take an MRI, you'll see the brain, but this is happening on a microscopic level in the neurotransmitters. You can't see it easily. You can't see it with finest PET scans and SPECT scans. They don't see that. That's why these are so hard to study and pin down as far as the etiology and pathophysiology. But they are physiological disorders, just like heart disease. And we're getting better. We're getting better at looking at this by various, very sophisticated means. I'm driving my boyfriend crazy. How can I stop talking too much? Well, if you're in a manic episode or a hypomanic episode, seek treatment for it.
What about the top question?
The top question I'm going to leave alone for now. But the answer, I'll tell you, the answer is no. Probably not. It's not due to that alone, probably. Okay. Do you have any information on IV ketamine? And where do I buy it? Very interesting question. Ketamine is an anesthetic used a lot in kids, not just animals, and in children. It's a general anesthetic agent. It's a very popular one with anesthesiology residents to abuse. Why? Because if you take one dose of it, IV, or IM sometimes, you often feel good for a month. Pretty nice. And so it's being investigated as a treatment for major depression.